Hello, everyone, and welcome to today's Triple Tree Thought Leadership session. Before we get started, I'd like to go over a few items to help you get the most out of today's session. You've joined the presentation listening using your computer's speaker system by default. If you'd prefer to join over the telephone, just select telephone in the audio pane and the dial-in information will be displayed. You'll have the opportunity to submit text questions to today's panelists by typing your questions into the questions pane of the control panel. You may send your questions in at any time during the presentation. We will address questions throughout today's discussion. I would now like to introduce Michael Carroll.
Hi, everyone, and welcome to Market Insights Live. As Lori mentioned, my name is Michael Carroll, and I'm the Chief Marketing Officer at Triple Tree. Today's session is focused on the trends and themes shaping healthcare in the coming year. We are joined today by a diverse group of leaders who each focus on different aspects of the healthcare industry, from a focus on healthcare services to healthcare technology, to providing investment banking advisory services, to financial solutions tailored specifically for healthcare organizations. As Lori mentioned, a reminder that you can submit questions through the questions panel on your screen. As we begin today, let me introduce today's conversation leaders. First, I'd like to introduce my colleague, Justin Roth. Justin Roth is head of investment banking at Triple Tree. In his role, he is responsible for the firm's strategic direction and the overall management of business development, client engagement, talent acquisition, and development. Justin, good to see you. Next, I'll introduce my colleagues, Jason Grace, Managing Director at Triple Tree. Jason specializes in healthcare services and technology with a focus on payer, employer, and consumer end markets. Next, my colleague, Michael Huey, Managing Director at Triple Tree, also specializing in healthcare services and technology with a focus on managed care, care delivery, multi-site care, technology-enabled payer solutions, pharmacy and pharmacy benefit management. Michael, good to see you. And next, Jeff Jones, Managing Director out of New York. Jeff specializes in healthcare services with a focus on post-acute, behavioral health, specialty and institutional pharmacies, and tech-enabled services. Jeff, good to see you. And today we have special guests from our new colleagues at Capital One. I'd like to introduce next Richard Virala, who's the Senior Managing Director with Capital One Healthcare. Richard is Capital One Healthcare's corporate finance team leader for healthcare services. He's responsible for originating debt, equity co-investment, and banking opportunities. Richard, thanks for joining us. And last but not least, our colleague David Oberdorf, Senior Vice President with Capital One Healthcare. David is focused on monitoring and analyzing the healthcare market for Capital One Healthcare's team. He currently covers the post-acute sector along with macro healthcare policy issues. David, good to see you. And as we begin today, I'll turn things over to Justin Roth for a quick perspective on 2021 and some thoughts on how 2022 will be impacted in the industry. Justin, take it away.
Hey, thank you so much, Michael, and all of you joining us today. It's just a real privilege to be able to share the next hour with you. There is so much excitement and momentum that we take from the past few years into 2022, and we're thrilled to have the opportunity to share those perspectives with you today. It's awesome to be joined by my colleagues here from Triple Tree, but really, really neat for us to have our first opportunity to collaborate with our colleagues Richard and David from Capital One, and thank you both for joining us here as well. As we kick off, I thought it would be important for us to look in the rearview mirror and see where we've come from to really have an appreciation of where we are today. And as you look at this slide, it's a lot to take in over video, but to just unpack it quickly, the global M&A activity in 2021 was absolutely unprecedented. With results still coming in on controlled transactions, there has been over 28,000 transactions in 2021, representing $5.3 trillion of enterprise value. On the healthcare front, healthcare is making up an increasing share of the M&A activity in the marketplace, representing 3,000 transactions in 2021 and $500 billion in enterprise value transacted. At 17.7% of GDP, healthcare is here to stay as a part of our country's economy. As a result, there is significant opportunity for investment, for transformation, and a impact from an M&A environment that we see as incredibly durable, in particular when balanced against times of dislocation in the marketplace. If you look back at the recessionary periods of 91, 2001, 2008, and 9, while healthcare pulled back a bit from an M&A activity standpoint, the reality is the pullback was certainly moderated relative to the broader global M&A environment. More importantly, anytime we've ever seen a pullback in a recessionary period, healthcare comes out and accelerates extraordinarily more quickly than any other area in the marketplace as well. As we think about the broader marketplace and turn to the next slide, it's one of those things when you think about the overall healthcare environment, and in particular in 2022, COVID is, with Omicron, it's still very much a part of our lives. The overall utilization of the healthcare system has changed. One of the things that is so important, though, is that as we think about participation in the healthcare ecosystem and where transformation needs to occur, the last thing we can do is have the elements of reducing costs, improving quality, and enhancing the overall experience of healthcare become white noise as a AAA theme that we just continue to have repeated and parroted each and every year. It is here to stay as the key three themes that our marketplace and the leaders that participate in this marketplace must embrace to be able to add true value and to make an endearing and lasting impact on the overall healthcare system and the way in which we as individual consumers engage. If you just look at each of these vectors, we've made tremendous progress, but there's still so much further that we need to go. Healthcare costs in 2020 alone grew by nearly 10%. Today, healthcare costs $12,500 per individual in the United States. 14 to 16% of healthcare costs, excess costs, result from care variability. And there's over $130 billion of waste from inefficient delivery that still exists today. From a quality standpoint, how better? It's a bit of a difficult thing to look at, but one of the ways to measure how much further we have to go on quality is if you just look at the life expectancy in the United States. Life expectancy in 2022 dropped to 77 years from 82 years in comparable countries. As we think about patients that are experiencing and engaging in the healthcare ecosystem, nearly 13% of those are experiencing a clinical error in their care. From an effectiveness standpoint, there is gross disparity from urban communities to rural communities, from other elements of demographics. We have 44 million Americans that live in counties with a shortage of primary care. We have providers today that are spending so much time in administrivia that their ability to actually make an impact when it comes to their patients' lives is becoming more and more difficult. And a shortfall of those that are getting into the provision of care as a career choice is also being felt as we're seeing shortages across the broader United States ecosystem from an employment standpoint. And ultimately, at 35, the United States has a long way to go to really ascend into a leadership position when you think about the United States as being one of the healthiest countries that we would aspire to be in the marketplace. So with that as a backdrop, what we'd love to do today is spend time on 4 themes that we see shaping healthcare in 2022. One is the evolution of risk-based primary care models. The second is really looking at high-cost, expensive medical care, as well as high-cost drugs and their utilization. I don't think it's lost on anybody on this call the challenges we face as a country from a behavioral health standpoint, and we want to talk about the increased urgency that we see in that marketplace to do more and have a true meaningful impact. And then finally, as we think about healthcare technology, we think about data, there isn't an element of the healthcare ecosystem that isn't impacted by becoming much more efficient, much more effective, and leveraging data to create an experience for consumers, for providers, for employers, for payers, that is much more refined than anything we've seen in the past. Supporting all of this is a marketplace that we participate in. And it's very important for us to be able to take a step back and think through and really appreciate the lens of our partners in private equity, really looking in and understanding what's to come as we think about the lending environment and capital getting deployed in both of those areas into healthcare in 2022. So with that, we'll jump right into our discussion today. And what I'd love to do is start with you, Michael, as we think about the evolution of risk-based primary care. Really talk through it from the lens of what you're seeing coming into 2022 with risk-based care being a theme and the assumption of risk by providers being a theme that's been here for a while. What are we looking forward to in 2022 relative to risk-based care?
Great, thanks, Justin. Well, I think there's a lot that we can look forward to in seeing the evolution of risk-based primary care. Maybe a couple of themes to call out, because you're correct, this has been obviously going on in the marketplace for quite some time, but it continues to evolve. One aspect is, primary care physicians, primary care practices know how to provide good care. This is well aligned with how they want to care for their patients. But if we're asking primary care providers and their staff to accomplish all of that in an 8-minute fee-for-service visit, it's just not going to happen. And so one thing we're seeing is how do these practices evolve to have a more integrated approach to provide care to that patient? So not just the physical care, the behavioral health care, the pharmacy care, and how is a primary care practice going to do that? Are they going to build out all their capabilities on their own, or are they going to be enabling companies who can provide services into that practice to take care of those care coordination and other ancillary health activities on behalf of the practice? So I think we're going to continue to see the evolution of new models, both for practices to do this on their own and take the assumption of risk, as well as for other enabling companies who are going to assist that practice and take over those last mile of activities, often into the home, that the practice can't realistically do for themselves. Another big theme that I think we're continuing to see, and we'll see a lot of in 2022, is, while you're correct, this has been going on for quite some time, I think we've seen there are pockets of the country where this model of risk-based primary care has been successful more so than others. Areas like Florida, especially Southern Florida, Southern California. But I think what we started to see, especially just in 2021, was a real expansion of some successful models and practices into other geographies. Both groups that are taking their own capabilities and partnering with payers or partnering with other providers in new geographies to take this out into new states and new areas of the country. And also groups who are not the actual practice themselves, but are the enabling companies and are taking their capabilities and forming joint ventures or other structures with existing provider groups in those other geographies to bring risk enablement into new markets. So I think we're going to see a continued expansion of that, and that particularly motivates the investor universe as they see this as a clear win-win-win for all constituents, the payer, the provider, and the patient. So they clearly see a massive market opportunity if they can find investment vehicles, whether practices or enabling companies, to scale these models across the United States.
Thanks so much, Michael. David, as I think about, really all elements of taking risk and going at risk in care, we talk through it so much in terms of the lens of primary care being the quarterback here, but I think Michael just touched on it. I'd love to get your perspective, which is there is a broader ecosystem that is at play. There is certainly elements of behavioral health, certainly elements of transitions into home. What are you seeing from the winners out there in terms of how best to execute against, really embracing an at-risk model?
Yeah, I guess what I'd say is I think we're still in the early innings of this whole transition to value-based care. I think different people put out different numbers, but something like we're still under 25% in terms of taking like true global risk, upside downside risk taking. And so, listen, I think the U.S. healthcare system, right, is one part government and public, one part private. It seems very clear that Medicare, Medicaid, other government programs are pushing towards value-based care. It doesn't look like that's going to stop. CMMI, CMS, just put out a direct contracting and primary care first models. And so I think that certainly will continue. I guess just taking a step back, right, at a 30,000 foot level, I think our perspective is, and this goes back to the ACA, is as long as you put MLR caps on plans, right, which is essentially a profit cap, and I think in Medicare Advantage, as an example, there's an 85% MLR. As long as you're restricting the plans from making further profits, the incentives, the macro incentives exist for them to push the capitation downstream. And so I think that's what we're seeing, right? And our perspective is you'll continue to see that as long as that framework exists. And again, our expectation is that that framework will exist, will continue to exist. We've been extremely active in this sort of risk-taking primary care model space. I'd say from our perspective, we've seen all different kinds of models. We've seen, some taking partial risk, some taking full risk. We've seen some owning the docs. We've seen some establishing a network of docs. I think it's given that it's early innings, I think it's difficult to predict exactly, which one model or which few models might prevail in the end. I guess going to what Michael just said, one observation that I think we've had, one is what Michael said, which is the sort of geographic concentration in places like Florida and California that seems to be starting to expand to other geographies. Another observation that we've had is just in terms of the payers that you're working with. I think what we have seen is some of these primary care risk-taking entities have had greater success, at least to date, with working with Medicare Advantage plans and Medicare Advantage beneficiaries, right? And I think our perspective is a major reason behind that is that Medicare Advantage has this very formal, uniform, and long-standing risk adjustment mechanism. And so, as long as, so that provides them two levers to ultimately produce EBITDA, right? You can more closely control care and reduce costs, and you get to keep the savings there. But you could also, as you engage and touch the patient more frequently within Medicare Advantage, you can find a higher level of what's called RAF scores, right? Higher level of risk adjustment. And so if you're getting 85% of a PMPM, 85% of a higher number ultimately produces revenue and EBITDA as well. So I think one interesting observation, at least from my perspective, is we've seen greater focus on working with MA plans. I think that probably continues, at least in the near term, it will be our perspective.
Terrific. Thanks so much for that. And one of the areas as we move into really a marketplace, as I talked about earlier, with $12,500 per capita spending on healthcare, clearly there are expensive medical procedures. There's an incredibly high cost, in particular in the specialty drug into the marketplace. Jason, starting with you, when it comes to cost containment, what are you seeing as we head into 2022 from the payers and employers that you're working with in the marketplace, and how they're trying to address medical expense and really trying to contain unnecessary spend?
Yeah, Justin, a couple points to start out that answer is, first, I think we're seeing across the employer market a real interest in increasing interest in owning that spend, moving to self-funding models, being more aggressive in cost containment. And we're seeing the traditional managed care, carriers invest in their self-funded capabilities to allow for more flexibility, allow them to administer those plans, or of course a lot of investment in third-party administrators that are not affiliated with health plans that are trying to take on some of that market share. And at the end of the day, though, what that means is the group that is at risk for the spend wants to take more control of it. And it starts with benefits and how benefits are designed, whether that's an MA plan, whether that's an employer-based plan, whether it's consumer-focused individual plan. What are those benefits, and then how is the payer at the end of the day making sure that the patient, the member, understands their benefits? What are the navigational resources they're giving to the consumer so they can understand their benefits? And how can whoever's convening those benefits do a better job of coordinating the benefits so that not only does the patient understand what they have access to, but they take advantage of it? And there's a lot of technology, a lot of services around that both from an administrative perspective and a clinical perspective. The next step that, once you have that control over the spend is the site of care or who's delivering the care. And as we've just talked about, primary care is getting a lot of attention, a lot of employers, a lot of health plans. You've got retail pharmacies all investing heavily in primary care models. And how do you get a qualified physician to track, especially the patients that have the propensity to be high cost patients? How do you make sure that those patients are managed as effectively as possible? So it starts with primary care. If you can have that right primary care physician that's tracking the patient, making sure the patient gets the care they need. But we're also seeing next generation models related to utilization management. And I think one takeaway we're seeing in the market, and I think COVID has exacerbated this, is physicians are stressed. They've got a lot on their plate. As we know, traditionally, physicians do not have the time to spend, quality time with each and every patient. And sometimes they miss things. And sometimes they don't have time to know exactly what the latest evidence-based guidelines are, or what to do in a specific situation. Or they have one specialty, but they're seeing a patient that maybe it has a need that's outside that's their specialty, but they're doing their best to care for the patient. And so one of the areas that we're seeing a lot of traction in is just providing resources to those physicians to make sure they have the access to the right care for the right patient at the right time, and have that mentorship, have that guidance, have resources they can call upon to make sure they're getting the right care to the right patient. And then last, which is where we're going to get into next, is pharmacy, and how how employers, how health plans are making sure that the right drugs are being prescribed and used by the right patients that can actually be effective for them.
Terrific. Thanks so much, Jason. And I appreciate the tee up here for Jeff as well. We have seen just a complete explosion in specialty drugs here, Jeff. And in particular, they're solving incredible pain points in the ecosystem, but at the same time, they come with an extraordinary price tag. Talk to the group a little bit in terms of what you see from a specialty standpoint and what you are going to expect here as we look into 2022 and beyond, relative to making sure that the drugs are being appropriately utilized, but also we're being cognizant from a cost standpoint on behalf of both those that are paying for it and the consumer experience as well.
Absolutely. Well, in addition to some of the metrics and methodologies that Jason mentioned around utilization management and prior authorization and other tools at the payer's disposal, site of care we're seeing also apply in the use of specialty drugs. A lot of specialty drugs are infused, and a lot of these infusions, about half these infusions, are happening in hospitals, and which, relative to other areas where they could be deployed, there's a large differential in terms of the cost for administering infusions in a hospital setting. And so a lot of payers are using this lever in addition to other tools that they have to try to control costs. And that comes in a couple of different forms. It can be just having much lower copays or no copays for their members to receive infusions in other sites of care, whether that be the home, in a physician's office, or in an ambulatory infusion center. In some cases, for some categories, they may not provide payment for infusion in a hospital setting at all. And so there's kind of different levels of activity that we're seeing out of payers in terms of really trying to push some of these very high cost biologic infusions out of hospitals. And what we're seeing is a real impact from the investing and deal activity perspective on these other end markets to where these infusions could be going to, into home infusion, physician office, and ambulatory. And what often the discussion with a health system and a payer may be, look, there's really no other place for these infusions to happen in our market. And there's the home infusion industry is probably the most built out of the three, and there are certainly lots of services in the home around home infusion, but there are a lot of infusions, a lot of biologics that have just a safety concern about being administered in the home. You really need a clinical setting for some of these infusions. And so there's what the market is finding is that there's a real dearth of locations, clinical locations, for some of these more complicated or certainly longer infusion categories. So that's the benefit of infusions happening in physician office, but also probably the most active sector within infusions is ambulatory, where there's just there's maybe 500 centers nationwide in ambulatory. So there's a lot of investing going into creating this environment where a lower cost of care can be achieved in partnership with payers in many cases, and we're seeing increasingly now also in partnership with health systems to create that right clinical backdrop for receiving infusions in your communities.
That's terrific. Jason, maybe throwing it back to you. As you think about what we just talked through, a lot of times when you are dealing with elements that are trying to reduce cost of care, it can be abrasive to the providers that are providing that care. When you talk about narrowing the destinations, Jeff, as you were just highlighting in terms of where an individual can go receive care, it can be dislocating to the consumer. But Jason, as you think about really the transformation that's afoot here, how do you see the consumer and those around the consumer doing what they can to alleviate dislocation that could come from that which could be perceived as traditional managed care hammers and gates as we think about kind of this wave of trying to make an impact?
Yeah, Justin, it's a great question, and I don't get me wrong. This is not easy to pull off, and you need to know what you're doing. I think to do it successfully, because it can be really confusing. We've seen a lot of growth in the reference-based pricing market, for example, and have been involved in several transactions in that world. And I think the vendors in that world that are successful are figuring out ways to make it a lot easier for the consumer. How to get the information in front of the consumer so that they're picking the right providers that will accept a reimbursement model like that. And on the clinical side, again, it's enabling and arming the patient to have the conversations with their provider. What questions should they be asking? How do they get to the right information in the first place? And on the clinician side, it's again arming them with the information. Is the information that the health plan or the criteria that the health plan is using for a clinical decision, something that is disputable, or is it coming from leaders in the field that if you really sit down and the clinician is willing to listen to the logic behind it, is undoubtedly the right way to go. And the clinician, I think in those cases when they're educated and they have an open mind to learn, are seeing that maybe they missed something or maybe they didn't know. So there are always exceptions to all of these things, but I think at the end of the day, it comes back to data, getting the information to the right person at the right time.
Thanks, Jason. Really appreciated it. As we move into our third theme on the behavioral health front, it's not lost on anyone how challenging the pandemic has been when it comes to behavioral health. And it really has opened up, I think, our collective eyes to supply and demand imbalance, access, and opportunities that we have to address to make sure that individuals are getting access to appropriate care that isn't just in acute settings, but is in environments that can really make a lasting impact and a transformational impact over time. Jeff, as you look past, or as you look at the last couple of years, how have you seen this marketplace evolve?
Yeah, it's a great question, Justin. There's really all areas of behavioral health have been impacted, and there's across the board, really over the last decade, since behavioral health has come more embraced by the payer community and legislative community, and behavioral needs have been better covered. We've seen a huge rise in demand, and the supply has just not been there to meet that demand. And so a lot of categories have been very active, building out that supply. Autism has been incredibly busy space for several years now, probably one of the most acute supply demand imbalances in behavioral health, if not across healthcare, where families may in some cases have to wait 12 to 18 months just to have an initial assessment of their child, to understand what is the degree to which their child may be on the spectrum, and what services do they need. And those are valuable. Every day and week that they lose is valuable to that family. Another category, just in general, outpatient mental health, and this is not, doesn't need to be highly acute, but general mental health and addressing depression and anxiety. There's been every year an easing in stigmas around mental health in general, and so it's led a lot of folks to more readily access mental health in their communities with psychiatrists and psychologists. And so we've seen individual practices grow, and particularly the last recent years, platforms developing regionally and nationally to unite your practices in the psychiatric and outpatient kind of general practice. Substance abuse is probably one of the oldest categories in terms of where we've seen investing dollars and deal activity. One of the key things that has changed in recent years around substance abuse, I think, is a growing recognition of just the chronic nature of addiction and substance abuse. And so this is, I think, fundamentally shifted focus, into outpatient, into medical assisted therapy, programs. We're increasingly seeing not only methadone clinics, but also buprenorphine and Suboxone being really accepted and favored by payers. In all of these categories, it's very difficult for payers to assess. Sometimes there aren't tests and ways to figure out if you're better or not. It's very subjective, and so measuring outcomes and data and picking good providers over ones that are poor performers is very difficult to assess. And so I think that's been one of the key challenges. So we've seen a lot of technology come into the behavioral health market as well to help with each of these. And the last category I'd mentioned is just adolescent care, kind of in general, and that it touches on eating disorders, a disproportionate number of eating disorder and undiagnosed in particular are adolescents. We're seeing a lot of pressure. Really, COVID has brought a lot of this to light, but even predating COVID, pressures on youths in the schools and school delivery strategies as well.
So, David, going back to what Jeff had touched on relative to addiction being, a very, very pronounced category within behavioral health for so long, we've made tremendous progress in the reduction of prescriptions for opioids. However, how have you seen that reduction in scripts translate into differentiated care or a differentiated environment relative to behavioral health?
Yeah, I guess what I'd say just in terms of our lending and what we have seen is, I think, I guess 5 years ago or so, for the first time we saw the opioid scripts start to decline. I think if you look at the CDC data, they've actually declined substantially, like something like 45% from 11 to 20. And so as we underwrote some of these transactions, right, that was a risk concern of ours, right? So if the opioid scripts are going to start to decline, you start to see a reduced demand for these services. We thought you wouldn't, but I think that's sort of played out, right? Which is, you've seen this reduction in script volume, but you continue to see an ever increasing, and I think 2020, partially caused by COVID, was maybe the greatest year, unfortunately, of opioid deaths. And so I think the reality, at least from our perspective, is even with a reduced script volume, what we've seen is just a transition to some more illicit and illegal opioids, fentanyl and the like. And we've continued to see demand for substance use disorder services just continue to increase unabated.
Thanks. A difficult set of circumstances to even wrap your head around, where it's almost feeling like a game of whack-a-mole. We're solving one problem, and yet there is a acute need that just still remains and is persistent. Going back to something that I touched on earlier too, David, how have you, in your research, how have you seen the impact of provider shortfalls in the behavioral health community either impede or impact the broader provision of care to those that need it most in the space?
Yeah, I mean, there, certainly in sort of psychiatrists, psychologists, there are shortages of those doctors. I do think to some degree, at least during COVID, and we'll kind of have to see how much this sticks post-COVID, but telehealth to some degree has enabled sort of greater productivity. So again, we'll see where telehealth goes, but especially for things like talk therapy, which very easily transition to telehealth. I do think that has some potential to ease the provider shortage, just by allowing sort of greater productivity via telehealth. But yeah, no, it's a real problem, and ultimately, if you don't have the doctor, you can't take the patient, and so it's a real issue.
Michael, good to see you again. Do we have a question from the audience?
We do. We have a couple of questions, which I'm going to try to stitch together. And actually, it does stitch together our first three topics around kind of value-based care, cost containment, and then behavioral health and specialties. Questions are really around any thoughts from this group around interest in or momentum behind value-based care structures with regard to specialties. Anything that we're seeing in the marketplace in that regard.
Sure thing.
I'm happy to.
Michael?
I'm happy to kick us off. I think you're right, Michael. It does stitch together a few of those topics. So we started this conversation around risk-based primary care. We are seeing the evolution of risk-based care in other categories, other specific specialties. We're seeing this play out quite a bit in the musculoskeletal or orthopedics category, both with bundles, but also other advanced forms of taking risk and managing what can often be very costly episodes that in some cases can be entirely avoided with the right kind of medical interventions, or at least can be handled more appropriately with good cost and quality outcomes. We're seeing this in oncology, another obviously very high cost category with very significant deviations in practice patterns and ultimate results, which Justin touched on at the beginning. So I think we are seeing a proliferation of that. Within behavioral, I think there are some evolving models as well, but I think if you branch out the tree, starting with primary care, I think we've seen the evolution be both with specific physician specialties and then enforce specific episodes of care that could touch on some other aspects like behavioral.
David, anything else that you'd add?
Nope.
Well done, Michael. Appreciate it. As we think about the fourth theme here, and that is really the impact of technology and really, turning in data and all the ingredients that come through the healthcare ecosystem into actionable intelligence on which we can improve the overall ecosystem. Jason, maybe looking at it again through that employer payer lens, and then ultimately kind of how they think about the consumer. How do you see technology interventions really transforming here in the coming years and beyond?
Yeah, Justin, let me first start with something David mentioned is capacity. And I think, I'm personally concerned about clinician shortage issues, not just in COVID, but as the stress that the healthcare delivery system has gone through, what that's going to mean for staffing for years to come across specialties, across all levels of care, all sites of care, all types of providers, all the way from physicians to people that are cleaning hospital rooms out. So I think one area of technology, whether it's telehealth, whether it's automated care capabilities, remote diagnostics. There are just so many different kind of software solutions that are trying to help diagnose better, treat without any clinician intervention through automation and algorithms. So I think that's one area that we're very excited about at Triple Tree, is just how technology can increase capacity in the healthcare system and allow more people to get better treatment than they are getting today or may get in the future. From a consumer perspective, as you think about different experiences, I think consumer expectations about how the healthcare system is going to use technology continues to increase every day, because we are using technology more and more in every other part of our lives, and sometimes and many times healthcare is behind in that regard. And so everything from scheduling, access to information, how you're able to follow up with your provider, a telemedicine experience, when that's allowable, when it's not allowable, the time at which you can access care, doing live chat with your health plan to ask a benefits question. I just think some healthcare services companies, some health plans and healthcare payers are investing heavily in some of these ways to communicate, and some are behind. And so I think the consumer expectations are not going anywhere. They're only going to increase. And if you're not making some of those investments, thinking through some of those investments now, I think you're going to start losing mind share.
Michael, thinking about the same, ingredient for success, but through the lens of the provider community, and in particular, thinking about, primary care, but also other multi-site models, and how you see technology, and kind of making a real meaningful impact in distinguishing kind of the winners from the losers in this marketplace. How do you see technology making an impact on the provider community?
Sure, I think it could have a huge impact, and I'm sure it differs by area or specialty. But going back to EMRs when they first came out, I think you could talk to any provider on the street, and they would tell you it was not helpful to their job. This was administrative work that just actually slowed them down, was clunky, and didn't actually got in the way, frankly, of patient care. I don't know that we're completely on the other side of that, but I think we're seeing now technology is actually, technology that those same providers use in every other aspect of their lives is now being configured to actually streamline that interface with the patient, show them data, longitudinal trending, so they understand what's going on with the patient. They can see it, they can work with it very easily. Ways for them to interact with that patient. Maybe it's not in that 8-minute, face-to-face visit, but they have now a way to text or even video chat with their patients. So I think we're seeing an evolution towards technologies that providers actually are embracing more, not just using because they have to. And I think that as we as the consumer think about where are we going to go for our care, as Jason mentioned, our expectations are high. So I do think to your point, Justin, providers that are utilizing and embracing technology in their practices, I think they're going to be on the winning side of healthcare as it relates to gaining consumers and patients. And then just briefly back to where we started the conversation around risk-based primary care, that cannot be done without technology. It starts with the data, knowing where and how and when to intervene with patients. So I think that's only going to become even more important.
No question about it. And, we did have a chance to touch on it relative to virtual health and the impact on both primary care and behavioral health. But Jeff, let's maybe think through it through the lens of where do we see technology making an impact as we think about provider recruitment, onboarding, training, development. What have you seen in the marketplace?
Yeah, well, and David touched on it a little bit earlier in terms of shortages of physicians. Jason also mentioned as well. It's something it's a real issue across healthcare, but particularly in behavioral health. There's a shortage of really kind of every level of clinician, and so having the right tools to have a database that you can recruit from and do it in an efficient manner, so that you can perpetually be able to kind of refill folks that you may have lost. Technology that's based around training, or that's based simply around making their jobs easier, making the clinician's job easier, whether it's in note-taking or in management or care coordination of the patients that are under their responsibility. All of that helps with retention at the end of the day. And so we're seeing technology used in all of those ways to really try to help reduce the employee turnover as best that you can to keep your business going and deliver the best care that you possibly can.
So much.
Jeff, I think part of it also is scheduling and capacity management. There's a lot of physicians that are booked, day over day and have a waiting list. And there may be excellent physicians at that same hospital or at that same clinic that have capacity. So how are you making sure you're load balancing in the right way?
Yep.
Some pretty innovative technology solutions that are helping to address that. And part of it is in the consumer front end too. How willing is that healthcare delivery organization to open up those schedules to the consumer and allow them to pick?
Yep.
Would I rather go to this physician and wait a few months, or would I rather be seen right away by somebody else?
Well, just
Justin, you're back.
I was just going to give one quick one on that, and this isn't necessarily technology, but just going to the capacity issue, right? Like a Medicis, large home health company, they have a stated goal, right? In their episodes, they want to use more than 50% PTAs versus PTs, more than 50% LPNs versus RNs. It's a lot easier to bring a PTA, to bring on more supply of PTAs than it is to bring on more supply of PTs, right? And so I do think part of the reason they do that is because it's margin accretive, right? We get a bundled payment if we can reduce our costs. But that also does help, I think, the capacity issue, right? If you can bring on some of these sort of lower cost, more ancillary service providers, that helps with the capacity.
Thanks,
Hey,
David.
two questions that are relative to COVID, one tech-enabled and one kind of just a more general question on. But when you think about technology, any perspective or thoughts from this group on the role of RPM or remote patient monitoring capabilities and how that fits into kind of a virtual health strategy? So that's sort of the first question. And then related to COVID, any thoughts around where urgent care fits in the way of solving some of the capacity constraints, and any perspective on how COVID has shaped that sector of the market?
From a surveillance standpoint, Michael, would you mind weighing in?
Sure. From a remote, I'd say remote patient monitoring and using that term very broadly perspective, I think we're seeing incredible both evolution in different models, utilizing technology, plugging in an actual caregiver to interface with the patient at that point as desired. But this has so many applications, and it touches on so many things we've already talked about here today. Capacity, just having someone have eyes on the patient that's not requiring an actual caregiver's time. But to the point you raised, Justin, just constant surveillance. So whether this is someone stepping on a scale or using a blood pressure cuff, if they're measuring vital signs for a particular condition, or if this someone has a tablet and can engage digitally with their health or with their condition, and there's someone on the other side of that who's monitoring and surveilling for any changes in condition, or something even as basic as a PERS or an emergency response device, but at the push of a button, can get a hold of someone that can help them through any medical issue they're having. All of these things are being leveraged now, less from a pure safety perspective, and now more of a proactive management perspective to actually get in front of any deterioration of a condition, and done at a much lower cost point than with an in-person visit.
Well, again, I think as you touched on, being able to identify changing condition in the moment and being able to bring direct interventions in and around that individual is so important to avoid that unnecessary escalation of cost and an abrasive experience for the human being throughout the healthcare ecosystem. And I think, Michael, to kind of hit on your other point, I'd turn to David, which is what do you think about kind of the role of urgent care today and really the investments in and around bringing care more close, maybe not into the home, but very, very convenient for the individual to access to, again, improve their overall health and well-being. David?
Yeah, I mean, listen, I think the entire premise of value-based primary care, right, is greater touch, greater engagement allows for lower costs. And so, the CVS, the Walgreens of the world, the urgent care centers of the world, I'm in New York City. There's probably 30 of those within a 5-block radius of me, right? And so to my mind, that it provides access. Now, I think we'll have to, maybe the jury's still out on whether there's sort of continued engagement, at least today, with those models, but the access is there, and I think that's a huge part of a value-based primary care is providing greater access. I think the second part is providing greater engagement. But yes, listen, I think that's what those have going for them is that they provide great access points. There are a lot of them within, close to the patient.
Thanks for that, David. Transitioning here, Richard, thanks for your patience as well, but you are, in your organization in particular, are really helping to lead this marketplace's ability to invest in and help fuel this transformation that's afoot that we've just been discussing for the better part of the last 50 minutes. Maybe, again, before we kind of step into 2022, it would be terrific to have you compare and contrast kind of 2020 to 2021 and really what you've seen in terms of the transformation from your desk on the lending front.
Sure. First of all, even before I get into 2020, I'll start by saying that the lending fundamentals in the lending market is a very good asset class and continues to attract capital, and that capital has to be deployed to support M&A transactions, dividend recaps, things of that nature. So it's a very strong fundamental market. In 2020, when the world locked down, so did many transactions, right? And so there wasn't a lot of money that was lent during that time frame. There was some, but a lot of the transactions that could have been put on hold were put on hold. As we got towards the back end of 2020, and the world started to open back up and patients started to return to doctors' offices and the world adjusted, then transactions did start to occur and the financing market was there. Coming out of 2020 into 2021 was a lot of pent-up demand. So again, the fundamentals were good. So you had the money that was there that was ready to support these transactions. 2021 was record-breaking on a number of fronts, on the M&A financing side as well as the dividend recap side. And right now there's kind of three big themes that I'd say that are going on. Number one, there's a lot of liquidity in the market because it's a good asset class. What does that mean? That means that there will continue to be borrower-friendly terms, better leverage, looser covenants, things of that nature. The other key theme is, and this is very critical, is the default rate is very low right now. So you've got a risk-on mentality for the lenders, and the low default rate allows for the asset class to perform well and continue to attract capital. And then the third theme is, because the capital is there, you see some innovative capital structures and products that are in the marketplace. Unitranche, for example, we're seeing the growth of the private credit market, and of course the bank market continues to be there. Going into 2022, it's a very positive outlook. A new year brings new budgets for lenders. January they go to zero, so they're looking to deploy capital. Just about every deal can find a home. If I think about headwinds, clearly, we read about the potential for rate hikes. That was on the front page of the Wall Street Journal again today. That could, play out, but we are still at a very low lending cost of capital, so the market should be able to absorb that. The other headwind is inflation. We just touched on earlier in this session about the labor shortages. And then you think about the supply chain disruption for healthcare manufacturers. And the key thing there is, will companies be able to hit their growth targets, right? These transactions have been structured, at near perfection. So it's critical that companies make up for these challenges, labor shortage challenges, either with technology and or how they change their staffing. But I'd wrap that question though by saying 2022, the outlook remains very positive.
Thanks so much for that, Richard. Really appreciate that. And we certainly agree. And Jason, a significant driver of the ability to really fuel this marketplace is the private equity community. What are you seeing from the private equity community as we step into 2022 and their interest level in deploying capital into such an important end of the marketplace in healthcare?
Yeah, Justin, as many of those in our audience know, the private equity market is growing rapidly, and there is a lot of demand to deploy capital. Some of the stats are staggering. Global dry powder has reached over $2 trillion now, like up to 2.3 trillion. That's almost double over the past 5 years. And healthcare is garnering even more as a percentage. So, I think where healthcare was about 11% of private equity deployed capital just a few years ago is now up to over 17%. So you've got more private equity capital, you've got more of those private equity dollars going into healthcare. You've got the duration of the funds decreasing. So private equity funds are holding their investments for a shorter period of time. They're raising that next bigger fund sooner, and it's creating more and more transaction activity. Certainly investment bankers like that. But the big takeaway is that the investors, the limited partners, want more. They like these private equity returns, and private equity is projected to outperform many other asset classes. So you see these larger, pension funds and other pools of capital that have more and more capital. Their capital has been compounding and growing year over year for many years, and they want to deploy more of it into private equity and are potentially taking it out of other asset classes. And for that reason, we just expect the market activity to continue, and we know that healthcare will at least maintain, but potentially even increase further as a percentage of the industry allocation of private equity over the next few years.
Terrific. Thanks, Jason. And I would just add too that, although there is a extraordinary amount of capital within private equity, with an LP investor base that's very excited about the return potential within healthcare, there is still very significant opportunities for private equity players to differentiate themselves, whether it's super subspecialization, whether it's what they could do from a leadership team standpoint and from an experience and advice standpoint. There is still plenty of ways for our private equity brethren to differentiate and make an impact, even if it is a marketplace that's garnering more attention and more magnetism here today. With that, we're going to quickly go around the horn, rapid fire. Let's go 20 to 30 seconds or less. What are you most excited about for 2022? Jeff, I'm going to start with you.
I think we're going to see a lot of crossover investing. We've seen a lot of it this year in years past, but I think that's accelerating. Folks from the consumer world, the technology world, industrial world, government services world, all coming into healthcare.
Thanks. Richard, how about you?
Yeah, I would say that I'm most excited about financing innovative companies, because in the healthcare market, it's ever changing, and that's where our expertise, we can lean on that, and we've served clients for many years. So very excited about that. And I'll quickly say my wife is very excited that hopefully I get back to the office and out of the house.
That's outstanding. Coming from his home office, Michael, how about you?
Sure, I'll echo that comment of looking forward to a bit more of a return to normalcy, in particular in transactions in the provider space, physician practices, other PPM and multi-site models. We certainly have seen a number of transactions that have started to come out post-COVID, and those have been, frankly, premier assets, premier businesses, but I think there's still pent-up demand for a lot of businesses that have been growing through COVID, have managed the storm, and I think we're going to see an acceleration of that activity.
David?
Yeah, listen, I think to Richard's point, healthcare system, U.S. healthcare system is ever changing, but historically it seems pretty slow changing, right? Those changes seem to happen over a very long period of time. I think there's some chance with COVID, right? We've seen existing trends get accelerated. Telehealth probably is the greatest example of that, but even things like, post-acute discharges to home health versus skilled nursing facilities. And so I think there's some chance that what COVID is going to lead to is sort of greater change in the healthcare system. And I think that creates opportunities for investors. And so I'm excited about that.
Greater change at an accelerated pace, no doubt. Jason, last but not least, how about you?
Yeah, and to jump on top of what David said, I think as a healthcare community, we learned a lot. We've learned a lot during COVID. And I think there's a lot that once people can take a step back, and we're not stressed on, hospital over capacity and things like that, that is going to benefit the healthcare industry. So I'm really excited that I think 2022 can hopefully start to be a year of reflection on what we've learned and where we can take those learnings to drive further innovation and improvement.
Thanks so much. And I just want to thank again those that have joined us today, those that will hear this going forward. It's been a true pleasure and privilege to be joined by this team to share our perspectives on 2022. And we look forward to being there with you on this journey throughout the coming year. Thank you so much. Michael?
Thanks, everyone. I'll add my thanks on top of everyone else. Great to see everybody. Happy New Year. That concludes today's Market Insights live session. A reminder that you can view a replay of today on TripleTree's website. You can also find a podcast on your favorite podcast channel. Look for more information about upcoming Market Insights live sessions in the coming months. And again, on behalf of everyone here at TripleTree, Happy New Year. We wish you a healthy, happy, and prosperous year. Bye-bye.